The other so-called unhealthy fats are omega-6 fats, and particular fat called linoleic acid is a prime example, found in sunflower, safflower seeds, corn, cottonseed, soybean, canola oil. I highlight peanuts for a reason because it contains omega-6 fats and also good fats, as we are going to talk about very soon. But here's the point here. Omega-6 is not quote unquote all bad. It just simply needs to be balanced by a fair amount of good fats in your diet, such as omega-3s. Omega-6 can actually help decrease the bad cholesterol, so it is good in that sense. But as you will see, it actually also increases a toxic form of bad cholesterol called oxidized LDLs, which can then negate or lead to heart disease. So what are the bad fats? Well, we'll start with high amounts of saturated fats, trans fats, both of which would increase the so-called bad cholesterol or LDLs. They would also increase the likelihood of blood clotting, make you store more fat, and promotes inflammation. The bottom line is that all these processes taken together leads to angina, higher risk of heart attack, and death. And what about excess omega-6 fats? Well, the good thing is it lowers LDL, so it lowers the bad cholesterol, but it can and may increase a very bad form of cholesterol called oxidized LDL, and this goes up in a high omega-6 diet. Same thing happens, increased blood clotting, it makes you store more fat, so it makes you more insulin resistant, and it promotes inflammation. And the end result is still our poor guy with the angina, chest pain, heart attack, and possibly death. Now we'll go into what's called the other category of nutrient or macronutrient called the carbohydrates. Another group of foods that should be eaten at moderation are the low fiber carbs. High fructose corn syrup is a processed sugar, and it's analogous to trans fats in that it is a processed sugar, as trans fats are a processed fat, and both act as preservatives in some fashion, but they also enhance the flavor, unfortunately, of many of the foods that are considered bad for you. But this basically means that you need to train yourself to look for it and avoid it as much as you can. So white rice, baked potato, honey, sugar, white bread, bagels, they can actually raise your blood sugar quite fast. In fact, they developed a whole index to measure how fast your blood sugar levels go up within minutes of you eating any of these listed carbohydrate sources. And the glycemic index also allows for the so-called group of carbohydrates called the low glycemic and moderately glycemic carbohydrates. So basically, the lower the glycemic index, the slower that particular carbohydrate will increase your blood sugar, and we'll go into some of those types of carbs. But for our purposes here, I'm grouping sugars and starchy foods in the same category, as the category here is low fiber carbs. And similar to trans fatty acids, I would venture to say that to try to avoid high fructose corn syrup as much as possible, as this will lead to insulin resistance and probably disease and obesity when consumed in high amounts. And this is typical of the typical American diet, unfortunately. So what are the bad carbs? Well, there are the low fiber carbohydrates. We talked about them already briefly. Sugars, corn syrup. What they do is they increase insulin resistance. So your body can only take high blood sugar for too long before it becomes more insulin resistant, and the end result, you increase blood clotting. It makes you store more fat. And what's interesting here that you didn't see in the other slides, the so-called bad carbs actually lower your good cholesterol. The saturated fats actually increases your bad cholesterol and increases your good cholesterol. The problem is it increases the bad cholesterol much faster and much higher. But carbs are bad in a sense because they lower the good cholesterol. So what's the end result? Well, as the cartoon shows here, it makes you more obese, and obesity, as we've been talking about, can predispose people to possibly higher rates of heart disease, but definitely increased chance of insulin resistance and diabetes. So now for the good guys. The point here is to look at your diet as a whole and the balance of foods that you eat.